Hi, I'm Dr. Nick Scotta with River City Physical Therapy, and today I wanted to talk to you about how to successfully treat and end your knee pain for good without requiring medications, injections, or surgery so that you can return to the activities that you love. Now, knee pain can affect all ages and all ranges of people of activity level. So most often it'll affect runners, people who exercise regularly, whether they're CrossFitters or maybe they're Olympic weightlifters, or maybe you're a golfer and you have knee pain. Also, it can affect people and just their ability to move around day to day. Maybe you have trouble getting in out of a chair, or maybe you have trouble just moving around through your house, or you're someone that has grandkids or kids. You can't get up and off the floor with them because of the knee pain or stiffness. So knee pain can kind of cross all different types of populations. Now, there's a lot of different types of knee pain. Some of the more common types include knee pain that's kind of diffuse. You just feel it in the front of your knee. You just feel like, hey, I have this pain at the top of my kneecap, inside my kneecap, kind of just generalized knee pain, what some might call anterior knee pain. And it usually hurts when you sit for prolonged periods of times, and it hurts when you go up and down steps, and it hurts when you may be squatting throughout the day during different activities, such as getting up and down from a chair, or when you're playing your favorite sport or participating in your favorite exercise. So that's definitely one type of knee pain. Another type of knee pain is related to more of a stiffness in the knee, where you just can't quite move it well, and it feels stiff and tight after you sit for a long period of time, or if you're laying down for a while, it just takes you a little bit to warm up and to get back up. Another type of knee pain can be seen on the outside of the knee, down where some of the muscles and tendons attach, and it could be caused by irritation during running, tennis, or any other sporting activity that you like to participate in, and that usually manifests itself on the outside of the knee. And then you can have knee pain that's caused by the joint itself. So where the leg bone, the upper leg bone and the lower leg bone meet, there can be a problem at the joint there. And that can result in like a specific pinpoint knee pain that you can kind of point to. Maybe you have some clicking or popping or locking up of that area, and that could be indicative of something going on in the knee joint. So it's important to kind of look at the different types of knee pain, because it affects many different types of populations, and each one needs a different treatment approach. So one of the first keys to successfully treating knee pain is to find the root cause. In other words, figure out why your knee is hurting. And you'd be surprised that oftentimes the answer is not always at the knee itself. You also have to look at the hip joint in the back and the pelvis. Because think about it, if things aren't going well in your hip, low back, or pelvis area, then it's going to transfer abnormal forces down to your knee and putting extra stress on your knee. You also want to look at the ankle as well. If there's some issues with the strength and flexibility of the ankle, then that can place a little bit more extra pressure on the knee. So finding the root cause, sometimes it lies at the knee, but sometimes it lies above and below the knee, and that's why treatment often fails sometimes. Another thing you need to do is assess the risk factors for why your knee pain keeps coming on. So are you sitting too long during the day? Is your training regimen during your running need to be changed, or does your strike pattern need to be changed? Is there something that you're doing during the day that's causing your knee pain, such as your mechanics during your exercises as well? That can play a role as well. So that needs to be looked at. And those two things are very important for you to get the pain-free movement that you want so that you can return to the favorite activities that you love. Now, knee pain treatment often fails because just the symptoms of the pain are addressed. So if you come in and you have knee pain and the knee is the only thing that's treated and you never got better, that might be a sign that, hey, there's something going on above or below the knee that you need to treat. Well, if you're just treating the knee pain itself right at the knee, that's just treating the symptoms, not the root cause of why you're getting the pain. So that's very important to understand. So I would invite you to learn more about knee pain, the different causes, what treatment can look like, some self-exercise that you can work on, or things that you can do to try to identify what type of knee pain you have. Click some of the links below to learn more. If you specifically have questions about your knee pain and it's keeping you from exercising, running, playing with your kids, playing with your grandkids, or just sitting comfortably throughout the day, or just moving around your house comfortably, I would invite you to give us a call at 904-370-3257, and we'll be happy to talk with you about your knee pain and what it's keeping you from doing during your daily life and what it would look like to get you back moving pain-free. Look forward to hearing from you soon.